Most of the damage that accumulates in the eyes over decades does not announce itself. There is no pain when the photoreceptors of the retina are gradually depleted by oxidative stress, no sensation when the circulation to the optic nerve is compromised by years of elevated blood pressure and poor vascular health, no moment when the person notices that their night vision has declined to the point of clinical significance rather than simply the ordinary evening difficulty they have attributed to age. The visual system deteriorates quietly, at the cellular level, in the same way that arterial plaque accumulates and kidney function declines, through the slow accumulation of damage in tissue that cannot fully regenerate what it loses, driven by oxidative, inflammatory, and circulatory processes that are modifiable but that require the right inputs to be modified. The timing of this video matters specifically because of what the eyes are doing during the overnight hours. The retina and its supporting tissues undergo active repair and regeneration during sleep, through processes that include the clearance of metabolic waste from the photoreceptor cells, the recycling of the visual pigments that allow the eye to function in low-light conditions, and the restoration of the antioxidant pools that protect the retinal pigment epithelium from the oxidative damage of the day's light exposure. These overnight processes require specific nutritional substrates, and several of the most critical ones are found in concentrated form in specific fruits, whose consumption in the evening, specifically in the 2 to 3 hours before sleep, provides those substrates at precisely the time when the overnight repair cycle begins. This is not the standard conversation about carrots and leafy greens, though the lutein and zeaxanthin in leafy greens are genuinely important for retinal health and deserve every mention they receive. This is a conversation about the specific fruits whose compounds target the retinal microcirculation, the antioxidant protection of the photoreceptors, and the intraocular fluid dynamics that affect eye pressure during the overnight hours, and why the timing of consuming those fruits matters as much as the fruits themselves. Before anything else, what I share in this video is educational information only. It is not medical advice. If you have been diagnosed with glaucoma, age-related macular degeneration, diabetic retinopathy, or any other eye condition, please discuss any dietary changes with your ophthalmologist. What I want to give you today is the nutritional science behind specific compounds and their documented effects on the tissues of the eye, so that your dietary choices can specifically support the visual system through the overnight hours when it is doing its most important repair work. I am Dr. Andrew Carter, and I have spent 15 years working exclusively with adults over 60. Visual health is one of the most important determinants of quality of life and independence in this age group, and the nutritional dimension of protecting it is among the most consistently absent from routine conversations about eye health beyond the ophthalmology appointment. If this is your first time on this channel, subscribe right now because every week I bring you specific, grounded information about what your body needs after 60, and this video connects specific nighttime nutritional habits to the biology of overnight visual repair. Let me start with the biology of why the eye is particularly vulnerable to oxidative damage, and why nighttime repair processes are specifically relevant to visual health in adults over 60. The retina, the light-sensitive tissue at the back of the eye that converts light into the electrical signals the brain interprets as vision, has the highest metabolic rate of any tissue in the body per unit weight. It consumes more oxygen per gram than the brain, the heart, or any other metabolically active tissue. This exceptional metabolic activity produces a correspondingly large output of reactive oxygen species, the byproducts of oxygen metabolism that, when produced in excess of the tissue's antioxidant defenses, cause oxidative damage to the cellular structures they contact. The photoreceptors, the rod and cone cells that detect light, are particularly vulnerable to this oxidative damage because their outer segments are composed of polyunsaturated, fatty acid-rich membranes that are highly susceptible to lipid peroxidation, and because they are exposed to the full energy of incoming light for every waking hour, with high-energy blue wavelength light being particularly effective at generating reactive oxygen species in the retinal tissue. The macular region of the retina, where the cone photoreceptors responsible for central high-acuity vision are densest, accumulates the most oxidative damage over a lifetime of light exposure. Age-related macular degeneration, which is the leading cause of irreversible central vision loss in adults over 60 in most developed countries, is fundamentally a disease of cumulative oxidative damage to the macula, compounded by inadequate antioxidant protection and impaired retinal clearance mechanisms. The overnight clearance mechanism most relevant to retinal health is the function of the retinal pigment epithelium, the layer of cells immediately behind the photoreceptors that perform several critical maintenance functions. The retinal pigment epithelium phagocytosis, meaning ingests and recycles, the disc shed from the outer segments of the photoreceptors as they undergo their daily renewal cycle. It recycles the all-trans retinal back to 11-cis retinal through the visual cycle, regenerating the visual pigment rhodopsin in rod cells and the cone pigments in cone cells that are required for normal daylight and low-light vision. And it maintains the barrier function between the choroidal blood supply and the retinal tissue, regulating the nutrient and waste exchange that the photoreceptors depend on. All of these retinal pigment epithelium functions operate most actively during the overnight hours. The phagocytosis of rod outer segment disc shedding peaks shortly after the onset of darkness. The visual pigment regeneration runs through the night. And the antioxidant enzyme systems of the retinal pigment epithelium, depleted by the day's oxidative burden, are restored during the hours of reduced light exposure. Providing the nutritional substrates for these overnight processes in the evening hours, before sleep, ensures that the repair cycle begins with adequate biochemical supply. The first fruit I want to discuss is bilberry, and specifically its anthocyanin content and the documented effects of those anthocyanins on the retinal microcirculation and the photoreceptor function in adults over 60. Bilberry, Vaccinium myrtillus, the European cousin of the blueberry, has a history of use for visual health that predates the scientific explanation for it. British Royal Air Force pilots in the Second World War reportedly consumed bilberry jam to improve their night vision during night operations, and the subsequent scientific investigation into why this might work led to the identification of the bilberry anthocyanins and their specific effects on the retina. The anthocyanins in bilberry, primarily cyanidin-3 glucoside and other acylated anthocyanins, produce their visual effects through two main mechanisms. The first is the regeneration of rhodopsin, the visual pigment in rod photoreceptors. Anthocyanins bind to the opsin protein component of rhodopsin and accelerate the regeneration of the visual pigment after it has been bleached by light exposure. In practical terms, this translates to faster dark adaptation, the ability of the eye to adjust from bright light to low light conditions, and better sensitivity in low light environments, including at night. A study published in the journal Alternative Medicine Review found that bilberry extract supplementation in adults over 50 with age-related visual complaints produced significant improvements in visual acuity in low light conditions and in dark adaptation speed compared to placebo, with the effect most pronounced in adults with the lowest baseline anthocyanin intake from their diet. The second mechanism is the improvement of retinal microcirculation. The anthocyanins in bilberry support the integrity of the blood vessel walls of the retinal capillaries through their collagen-stabilizing effects and their inhibition of the collagenase and elastase enzymes that break down the structural proteins of the vessel wall. Weakened retinal capillaries are a feature of diabetic retinopathy and of the early changes in retinal vascular health that precede it, and the anthocyanin-mediated strengthening of the capillary wall provides a specific protective effect on the microvasculature that supplies the photoreceptors with the oxygen and glucose they require for their exceptional metabolic demand. Bilberries are not as widely available as blueberries in most markets, but their anthocyanin concentration is approximately 2 to 4 times higher than blueberries. Where bilberries are not available, dark blueberries, particularly the wild or high bush varieties with the deepest color, provide a significant anthocyanin dose with the same primary mechanisms, though at a somewhat lower concentration per gram. Type in the comments right now whether you eat blueberries or bilberries regularly, and whether you have ever connected them to your vision rather than to their more widely discussed cardiovascular and cognitive benefits. Because I suspect that most people eating these fruits are getting eye health benefits they are entirely unaware of. The second fruit is the kiwi, and its specific contribution to retinal antioxidant protection comes from an unexpected direction. It contains the highest vitamin C concentration of any commonly consumed fruit, surpassing oranges and strawberries, and vitamin C has a specific and well-documented role in protecting the anterior segment structures of the eye, specifically the lens, from the oxidative damage that produces cataracts. The lens of the eye is one of the highest vitamin C concentrating tissues in the body. Aqueous humor, the fluid that bathes the lens, maintains a vitamin C concentration approximately 25 times higher than the plasma, reflecting the active transport of vitamin C into the anterior chamber of the eye. This concentration exists because vitamin C is the primary antioxidant, protecting the lens proteins from the oxidative modification that causes them to aggregate and cloud the lens, producing a cataract. Age-related cataracts, which affect the majority of adults over 75 to at least some degree, develop when lens proteins are progressively modified by the reactive oxygen species and advanced glycation end products that accumulate with age and with elevated blood glucose. Vitamin C, present in adequate concentrations in the aqueous humor, quenches the reactive oxygen species before they can modify the lens proteins. When vitamin C availability to the anterior chamber is reduced, either through inadequate dietary intake or through the impaired active transport that accompanies aging and metabolic dysfunction, the protective antioxidant shield for the lens is weakened. A study published in Ophthalmology following more than 1,000 twins over 10 years found that higher dietary vitamin C intake was associated with a significant reduction in the risk of lens opacity progression, with adults in the highest quartile of vitamin C intake showing approximately 33% lower risk of cataract progression than those in the lowest quartile. The effect was independent of smoking, sun exposure, and other known cataract risk factors. 2 kiwi fruits consumed in the evening, in the 2 hours before sleep, provide approximately 150 milligrams of vitamin C in a whole food form, accompanied by the polyphenols and fibers of the whole fruit that support absorption and antioxidant synergy. Kiwi fruits also have an additional and well-documented benefit relevant to the nighttime context. Several randomized controlled trials, including one published in the Asia-Pacific Journal of Clinical Nutrition, found that consuming 2 kiwi fruits approximately 1 hour before bed improved sleep onset time and sleep quality in adults over 60 through a mechanism attributed to the serotonin precursors and antioxidant compounds in the fruit. Better sleep quality supports the overnight retinal repair cycle that depends on the processes I described, making the kiwi a nighttime nutritional choice that supports both the sleep architecture and the retinal repair that depends on it. And share this video right now with one person in your life over 60 who has been told they have early cataracts or lens cloudiness, and who has never been told that vitamin C intake is specifically relevant to the rate at which that lens cloudiness progresses. The protective effect is specific and documented, and the intervention is as simple as 2 kiwi fruits in the evening. And if you are not yet subscribed to this channel, tap that button now and ring the bell. I want to tell you about Patricia, 66 years old, retired librarian from Melbourne, Australia. She came to me with 2 concerns. Her ophthalmologist had told her at her previous annual visit that there was very early lens cloudiness developing bilaterally, and she had been experiencing what she described as poor night vision for about 2 years, finding driving after dark increasingly difficult. When I reviewed her dietary pattern, her fruit intake was minimal, her vitamin C was well below the optimal range at dietary assessment, and she ate almost no anthocyanin-rich fruits. Her diet was nutritionally adequate by standard measures, but was providing very little of the specific compounds relevant to retinal and lens protection. We added the specific evening fruit protocol I will describe: 2 kiwi fruits and a serving of dark berries, specifically blueberries or frozen bilberries, consumed about an hour before bed each evening. We also addressed her dietary vitamin C more broadly through the day. We added lutein and zeaxanthin from cooked spinach or kale, at least 4 times per week, which we discuss in the macular section of this video. At 12 months, her ophthalmologist noted at the annual review that the lens cloudiness had not progressed, which the ophthalmologist commented was better than expected in 1 year. Her night vision difficulty had improved subjectively, and she described her dark adaptation as noticeably faster than it had been, specifically that the transition from the lit interior of a restaurant or cinema to the parking lot outside no longer required the several minutes of near blindness she had been managing. She told me, "I did not expect food to make a difference to my eyes." I told her, "The cells of your retina and your lens are maintained or damaged by the same oxidative and nutritional forces that affect every other tissue in your body. Feed them the right compounds and the repair processes can keep pace with the damage." The third fruit is the papaya, and its contribution to visual health operates through a specific carotenoid pathway that is distinct from the more widely known beta-carotene vitamin A pathway. Papaya is among the richest dietary sources of lutein and zeaxanthin, the 2 carotenoids that are selectively concentrated in the macula of the retina, where they form the macular pigment. This pigment functions as both a blue light filter and an antioxidant shield for the central retina. Lutein and zeaxanthin absorb high-energy blue wavelength light, the same wavelength most concentrated in LED screens, smartphones, and modern artificial lighting, before it reaches the photoreceptors and the retinal pigment epithelium beneath them. In doing so, they reduce the photochemical oxidative damage that blue light produces in the retina, and they are themselves potent antioxidants, quenching the reactive oxygen species that blue light and metabolic activity generate in the macular tissue. The Age-Related Eye Disease Study 2, AREDS 2, one of the most important clinical trials in ophthalmology, established that supplementation with lutein and zeaxanthin significantly reduced the risk of progression from intermediate to advanced age-related macular degeneration in adults with existing intermediate AMD. The results of this study are so consistent that lutein and zeaxanthin supplementation is now recommended by ophthalmologists specifically for adults with intermediate AMD, and the dietary sources of these carotenoids are recommended more broadly for prevention. Papaya provides lutein and zeaxanthin in a food matrix alongside beta-carotene and vitamin C that supports both their absorption and their antioxidant function in the retinal tissue. The esterified forms of lutein and zeaxanthin, found in many fruits, including papaya, require bile acids for their cleavage and absorption, which means consuming papaya with a small amount of fat, such as a handful of nuts or a few slices of avocado, significantly improves the bioavailability of these carotenoids compared to consuming the fruit alone. A practical note on papaya timing. The proteolytic enzymes in raw papaya, particularly papain, are active in the uncooked fruit and support protein digestion, which is an additional benefit when papaya is consumed after an evening meal. The fruit's relatively low glycemic index compared to many other tropical fruits makes it a reasonable evening choice for adults managing their blood sugar, which is relevant in the context of the blood sugar retinal health connection I want to address next. If you are not yet subscribed to this channel, tap that subscribe button now and ring the bell, because every week I come here with exactly this level of specific, compound by compound nutritional information that makes dietary choices genuinely targeted rather than generically healthy. The connection between blood sugar stability through the overnight hours and retinal health is one that most people have not made explicit, and it is worth addressing specifically because of its relevance to the choice of evening fruit. The retina depends on glucose for its energy supply, and the retinal microvasculature, the smallest blood vessels supplying the retina, is among the most sensitive tissue in the body to the effects of chronically elevated glucose. The mechanism of diabetic retinopathy, which begins as microaneurysms in the retinal capillaries and progresses to the neovascularization and hemorrhage that causes vision loss and advanced disease, is the direct result of the glucotoxic damage to the pericytes and endothelial cells of the retinal capillaries from sustained elevated blood glucose. But elevated blood glucose is not only a concern for people with diagnosed diabetes. The retinal microvascular damage from chronically elevated post-meal glucose in the pre-diabetic range is documented in several studies, and even in adults with normal fasting blood glucose, the overnight blood glucose excursions that follow a high glycemic evening meal can produce transient oxidative and inflammatory stress in the retinal microvasculature. The choice of evening fruit therefore has a blood sugar dimension that is relevant to retinal health. Fruits with lower glycemic indices and higher fiber and polyphenol content, such as berries, kiwi, and papaya, produce more modest post-meal glucose responses than high-sugar fruits including watermelon, grapes, and dried fruits consumed in the same portions. For adults with any degree of insulin resistance or glucose dysregulation, the evening fruit choice that most supports overnight retinal health is the one that also produces the most stable blood glucose through the overnight hours. The anthocyanins in berries have a specific additional advantage here. They inhibit alpha-glucosidase, the intestinal enzyme that breaks down carbohydrates to absorbable glucose, producing a mild but meaningful reduction in the post-meal glucose peak from the fruit itself and from any accompanying carbohydrate in the evening meal. This makes dark berries doubly beneficial for overnight retinal health. Their anthocyanins directly support the retinal microcirculation through the vascular integrity pathway, and they reduce the post-meal glucose excursion that would otherwise create oxidative stress in that same microvasculature. The fourth fruit category is cherries, specifically tart cherries and dark sweet cherries, and their contribution operates through the anti-inflammatory pathway that is relevant to the intraocular inflammatory processes underlying both age-related macular degeneration and glaucomatous optic nerve damage. The anthocyanins in cherries, particularly cyanidin 3 glucoside, inhibit QX2 enzyme activity, the same cyclooxygenase pathway targeted by NSAIDs, producing an anti-inflammatory effect that has been shown to reduce the systemic inflammatory cytokine output, specifically TNF-alpha and interleukin-6 in multiple randomized controlled trials. Glaucoma, the optic nerve disease characterized by progressive loss of the ganglion cell layer of the retina, and the visual field deficits that follow, is increasingly understood as having an inflammatory component alongside the more traditional intraocular pressure mechanism. Neuroinflammation in the optic nerve head, where the ganglion cell axons exit the eye through the lamina cribrosa, appears to contribute to the progressive loss of ganglion cells in some forms of glaucoma, independently of the intraocular pressure. The anti-inflammatory compounds in tart cherries may provide some protection against this neuroinflammatory component, though direct clinical trials in glaucoma specifically are limited. Tart cherries also contain melatonin, a compound whose relevance to nighttime eye health extends beyond its sleep-promoting effects. Melatonin receptors are present in several ocular tissues, including the retinal pigment epithelium, the ciliary body, and the trabecular meshwork. Melatonin from endogenous production and from dietary sources appears to regulate intraocular pressure through its effects on aqueous humor production and drainage, and some studies have found that melatonin levels in aqueous humor are correlated with the circadian fluctuation in intraocular pressure that is a feature of most glaucoma patients' disease. Dietary melatonin from tart cherries consumed in the evening may provide a supplementary source that supports the overnight intraocular pressure regulation alongside its better-known sleep-promoting effects. A small serving of fresh or frozen tart cherries, or 30 milliliters of tart cherry, concentrate in water, consumed in the evening alongside the other fruits I have described, adds both the anti-inflammatory anthocyanin effect and the melatonin contribution that are specifically relevant to the overnight ocular environment. Here is the complete evening fruit protocol for visual health, built from the compounds and mechanisms I have described. The ideal evening consumption window is approximately 60 to 90 minutes before sleep, allowing time for the compounds to be absorbed and reach the ocular tissues before the overnight repair processes begin their peak activity. This window also avoids the large volume of food immediately before lying down that can worsen reflux in susceptible adults. The combination most supported by the evidence for overnight retinal health is a serving of dark berries, specifically blueberries or bilberries if available, providing anthocyanins for rhodopsin regeneration and retinal microvascular protection, 2 kiwi fruits providing high-dose vitamin C for lens antioxidant protection and the serotonin precursors that improve sleep quality and therefore support the overnight repair environment, and either papaya for its lutein and zeaxanthin carotenoid content, or a small serving of tart cherries for their anti-inflammatory and melatonin contribution. Where papaya is consumed, adding a small amount of healthy fat, a few walnut halves or half a small avocado, significantly improves the absorption of the esterified lutein and zeaxanthin. This does not need to be a large amount. A handful of nuts alongside the fruit provides the bile acid stimulation for adequate carotenoid absorption. For adults managing blood sugar, the serving sizes matter. A cup of berries, 2 kiwi fruits, and a half cup of papaya provides the compounds at useful doses without creating a significant glycemic load, particularly when the protein and fiber of the previous meal are still moderating the digestive rate. For adults with ocular surface dryness, which is common in adults over 60, and which is worsened by the meibomian gland dysfunction associated with chronic inflammation, the omega-3 fatty acids from the fatty fish consumed earlier in the day, as I have discussed in multiple previous videos, support the lipid layer of the tear film overnight. The anti-inflammatory anthocyanins in the evening fruit complement this effect by reducing the inflammatory cytokine output that is the primary driver of meibomian gland dysfunction and evaporative dry eye. 4 things to carry away. First, the retina and its supporting tissues undergo active repair and regeneration during the overnight hours, including rhodopsin visual pigment regeneration, retinal pigment epithelium phagocytosis of photoreceptor disc shedding, and antioxidant pool restoration, providing the nutritional substrates for these processes in the evening, specifically the anthocyanins, vitamin C, and carotenoids I described, supports the overnight repair cycle during the hours when it is most active. Second, bilberries and dark blueberries provide anthocyanins that accelerate rhodopsin regeneration and strengthen retinal capillary integrity through two distinct mechanisms that are directly relevant to night vision quality and to the prevention of the retinal microvascular damage that underlies both diabetic retinopathy and age-related vascular changes in the retina. Third, kiwi fruits are the most practical whole food source of high-dose vitamin C for lens antioxidant protection and cataract prevention, and their documented sleep quality benefit in adults over 60 makes them specifically advantageous in the evening context because better sleep quality supports the overnight retinal repair processes that require slow-wave sleep to operate at full efficiency. Fourth, blood sugar stability through the overnight hours is directly relevant to retinal microvascular health, and the choice of lower glycemic, higher anthocyanin evening fruits over high-sugar alternatives is a choice that serves both the glucose stability dimension and the direct antioxidant protection of the retinal tissue simultaneously. Your eyes are exposed to more oxidative damage per unit of tissue weight than any other organ in your body, and they are repairing that damage every night during the hours when you are not asking them to work. What you give them to work with during those hours, the specific compounds that support the repair cycle, the antioxidants that protect the vulnerable membranes, the carotenoids that shield the macula, and the factors that support the sleep quality the repair depends on, determines how much of the overnight potential is actually realized. The fruit protocol I have described tonight is one of the simplest and most targeted nutritional investments available for the visual health that determines how clearly you see everything else. Share this video with one person in your life over 60 who has been told their vision is declining and who has never been given the nutritional dimension of what supports the repair processes working in their eyes every night. And subscribe to this channel because every week I come here with one purpose: to give you the specific information that connects what you eat to the biological processes it is either supporting or neglecting. Aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.